cradle-to-grave care. It's what the National Health Service was set up to do, and it's what doctors and nurses here at St Mary's in Paddington strive to achieve. But shocking new figures given to this programme reveal that the NHS is fundamentally failing. They suggest that death rates in hospitals in England have been far higher than in other countries. And it's not just in the scandal-hit trusts you read about in the newspapers, but we're talking here about the average NHS hospital. The figures compiled by the eminent doctor and statistician Professor Sir Brian Jarman suggest patients are 45% more likely to die in hospital here than in America. And for conditions that affect the elderly, Sir Brian's statistics are even starker. They suggest that you're 5 times as likely to die of pneumonia on an English ward as an American one. In the first of our series of films analysing the state of the NHS, our health and social care correspondent Victoria Macdonald has this exclusive report.
He told me that the care was so bad in hospital that he would die there.
And I said, you know, he's in absolute agony. Surely somebody should have noticed this before now.
I took him in there after a fall with his pyjamas, etc. And I came out with a bag of pyjamas and no dad.
In the end, she had cancer, which was undiagnosed. She couldn't communicate. She was in a lot of pain, and all she was given was paracetamol.
21st century care in the NHS, not in the now notorious Mid-Staffs hospitals or any of the other trusts that have hit recent headlines. These are stories told to Channel 4 News by distressed relatives, all asking why their loved ones went into their local hospital and did not come out alive.
It's often said the NHS is the nearest thing we have to a national religion, cradle-to-grave care, free at the point of need. But what we also know from report after report, inquiry after inquiry, is that there are problems at the heart of England's health service. What we didn't know until now, because it's never been published, is just how badly we do compared with other countries when it comes to our hospital death rates.
For the first time, we've seen exclusive data that challenges our belief that we have a world-class health service. It shows that in 2004, our hospital death rates were so high, we were the worst when compared with 6 other developed countries, and that by last year, we were still far behind the best. The data is the work of this man, Professor Sir Brian Jarman. He made his name in the Bristol Heart Inquiry, and he spotted the terrible death rates at Mid-Staffs. For over a decade now, he has been amassing international data, turning it into hospital standardized mortality ratios, HSMRs. They're a way of measuring whether death rates are higher or lower than expected, and are adjusted for factors such as age and the severity of the illness. But the data is so sensitive, the only other country we can name is America, which comes out the best.
Can you explain the data and what was it that you found?
Well, what I found was that the adjusted death rate in England was about 22% higher than the average of all the 7 countries that I looked at. And it was about 58% higher than the best of the countries.
Professor Jarman was, quite frankly, shocked. His data was telling him that NHS patients were around 60% more likely to die in hospital compared with patients in America. For years he looked for a flaw in his methodology, but he says he hasn't found one. So now he's prepared to release the data, and it is indeed shocking.
What was your reaction when you saw this data?
I expected us to do well, and I was very surprised at the results that I got. But you can't, there's no means of denying the results, they're absolutely clear.
The first set of international HSMRs show that in 2004, England recorded 22.5% more deaths than would have been expected. That gave it the highest mortality rates of the 7 countries analysed. That was 10 years ago, and England has improved the fastest of the group. But for the latest data, 2012, NHS hospital death rates are still 45% higher than in America.
Why should people take notice of it?
I think it gives a very hard measure of differences of adjusted death rates between the different countries. And I think we should take notice of it and say, is there a problem in the provision of healthcare in England?
There is no denying, of course, England's health service is different to America's. Unlike the NHS, there is no universal access to healthcare here. But on one measure, the two are directly comparable. And it's the only outcome that truly matters for patients: survival. And that is where American hospitals do dramatically better. And here in Phoenix, Arizona, there is, according to the data, one of the best hospitals in the world. Even as you walk into the Mayo Clinic, it seems more like a hotel. But it's what's happening on the wards that really matters.
Can you tell me where you are right now?
I'm in the hospital.
Which hospital?
I think it's Mayo.
Yes, that's correct.
The figures are quite simply astonishing. A patient admitted here would be twice as likely to survive compared with a similar patient with a similar condition in an average NHS hospital.
This is a 75-year-old gentleman that 5 days ago had an out-of-hospital cardiac arrest, who came in with ST elevation, who immediately went to cath lab.
Morning rounds in the hospital's intensive care unit. Everyone involved in the treatment of the patient is expected to be there and to contribute.
So he's also day, 5 of antibiotics. Is there anything from a cardiology perspective that we're not doing that he needs to optimize his therapy?
Did find some other lesions in the other vessels, but they didn't appear to be critical, so I think we can manage them.
Make sure that every member of the team has ownership of patients and their outcome.
Safety is the key, checking and rechecking, videoing operations and analysing to learn from the best and the worst of practices, encouraging staff to reveal near misses and to blow the whistle when something goes wrong.
What's the most important thing there is about Mayo Clinic is that the needs of the patient come first. That is it. It's in the DNA, so to speak. At Mayo Clinic, everyone measures our peers, our colleagues, our co-workers, with that same yardstick. Are you doing what's best for the patient?
One of the criticisms that we have in the UK about the US system is that it's hugely expensive.
Correct. But is it less expensive than having a lot of deaths and having admissions that last longer and longer and longer because you didn't do it right the first time?
It's not just that American hospitals are better at keeping patients alive, though. They are also far better than the NHS at keeping elderly patients alive. And this cuts to the core of the health service we are so proud of.
There's no fight left in me today. I held my granddad's hand and it was as if we had both given up.
It's conditions such as septicemia and pneumonia which more often affect the elderly that have been measured. And the data shows a patient is almost twice as likely to die from septicemia and 5 times more likely to die from pneumonia in the NHS than in an American hospital.
I worked for the NHS. I thought, he's in the best place. This is where he should be. He needs the help, he needs the care. Whilst he was in the care, my grandfather had fall after fall after fall. With each fall, it had an impact on his health. I needed to document what was happening because there was times I couldn't actually believe what was happening. Hospital-acquired pneumonia was the next thing. What a horrible thing that really is. Grandad died late that day at 5:11 p.m. during tea time and visiting time behind a curtain. There was no dignity in death.
What you're telling us is that you are more likely to die if you are treated in an English hospital if you're over 65 than if you're treated in,
Yes.
for instance, the Mayo Clinic.
Yes, my data does show that that is the case, yes, from the evidence we have, that there is a higher adjusted death rate in the elderly in England particularly.
Well, that's shocking.
It is shocking, yes. And in fact, actually, when I saw this data, I think it was probably the stimulus for me to speak more openly about my concerns about the NHS. It's not to say that we don't have some very good hospitals, but I think we also have some very poor hospitals.
It's neglect. No human being should have to suffer like that.
The 2 weeks he spent on the ward, his care was lacking. And then he fell out of bed and things got even worse after that. And I do believe that if he'd received proper care, he would be at home with us today.
Lower spending, fewer doctors per patient, high obesity, alcohol and smoking rates, they all contribute to our poor data. But there is also, as Professor Jarman points out, a fundamental problem with the culture of the NHS.
I hope there will be a complete opening up, allowing whistleblowers to say freely the problems that they see, to allow clinicians and patients to be involved in the running of hospitals, to listen to patients. If you go to the States, doctors can talk about problems, nurses can raise problems, they listen to patient complaints. Now, we have a system whereby, at the moment, for written hospital complaints, only 1 in 375 is actually formally investigated. This is utterly appalling, absolutely appalling.
HSMRs have recently been described as a smoke signal that something may be wrong. Indeed, some people may dispute them and nobody says they tell the whole story. But today, the medical director of the NHS told us he was taking the data seriously and would be holding top-level discussions on it.
When you saw this data, were you shocked?
Look, I want our NHS to be based on evidence. I don't want to disregard stuff that might be inconvenient or embarrassing. You know, the HSMR exposed things in Mid-Staffordshire, and people spent a lot of time arguing about the methodology, about the data, and meantime bad things were happening. I don't want to be in that business. I want to use this kind of data to help inform how we can improve our NHS.
One of the things that I was shocked by was the data for the elderly. You are far more likely to survive conditions like pneumonia or septicemia if you're treated in an American hospital than in an English hospital.
Well, I agree with you. So what we need to do as clinical professionals in our NHS is concentrate on how we can improve that. And I will be the first to bring this data to the attention of clinical leaders in this country to see how we can tackle this problem.
The fact is, we have a health service that is admired around the world, founded on that cradle-to-grave principle. But the other fact is, we still have too many patients dying in our hospitals when their relatives were expecting them to come home.